Hi, I'm Natalia Jablokov, your host for Health and Wellness. I'm here in Wilmington, Delaware at Nemours Alfred I. DuPont Hospital for Children with Dr. Heather Nardone, a pediatric ears, nose, and throat doctor. Hi, Dr. Nardone. What does ENT pediatric specialize in?
Sure. So Pediatric Otolaryngology treats conditions of the ear, nose, and throat in children. And this time of year, one of the most common ailments that we treat are pediatric ear infections. Pediatric ear infections are incredibly common. They affect almost all children to the point where by the time a child reaches 3 years of age, almost all have experienced at least one episode of acute otitis media or middle ear infection.
And what is acute otitis media?
Sure. So essentially the area behind our eardrum is called the middle ear, and that's a space that's typically filled with air and houses the ear bones that allow us to hear. And in a lot of children, when they get a common cold, the congestion that they have in their nose actually spreads to their ear and to that middle ear space that we were just talking about. That space gets filled with fluid and then eventually turns into a full-blown ear infection with pus in that area. And once you have pus in that middle ear area, that's considered an episode of acute otitis media. So otitis, or ear, and media, middle, so an infection of the middle ear. So this diagram shows a nice depiction of the ear anatomy. This obviously is the outer part of the ear. When I'm examining a child, I'm looking into the ear canal, and the area that I'm most interested in is the ear drum, which almost looks like a piece of saran wrap that I could see through, to the area called the middle ear. The middle ear is a space that is filled with air and houses the ear bones that allow us to hear and detect sound. This is the space back here where children tend to get fluid when they get a common cold, and then that fluid turns into pus during an acute ear infection.
Wow, so how do you know when a child needs tubes, or if it just could be with antibiotics treated, or?
Sure, so almost always in young children, the infections are initially treated with antibiotic, and antibiotics are typically very effective in treating these types of infections. We have some situations where children are getting very frequent infections, and we have some situations where the infections are resistant to the antibiotics. Mm-hmm. And in those situations, kids could start becoming candidates for ear tubes. Generally speaking, we look for kids who are having more than 3 infections over about a 6-month period of time to consider them a good candidate for tubes.
Oh, wow. And so how do the tubes work once and then that's done, or do they have to continuously reapply them or
Sure. So the tubes are temporary.
Mm-hmm.
They're very tiny and they sit in the eardrum and they act to ventilate that middle ear space. So they help keep air in that space where the kids tend to get fluid and tend to get pus. And by doing that, it decreases the likelihood that kids will get yet another infection. Mm-hmm. So they're very effective in that way. They're a temporary fix. So the tube typically lasts about a year on average, and then the eardrum gradually kicks it out. And what we hope is that over that year, the children's immune systems mature and that their ear anatomy matures and that they start to outgrow the tendency to get these types of infections. This diagram here depicts the tympanic membrane or eardrum and tries to show what an ear tube looks like when it's in place. So when we place an ear tube, we make a tiny nick or incision in the eardrum, and then we place the tiny vent in place. The vent is tiny, it's about 1/20th of an inch, and it has an empty barrel. This is a side view or a profile view showing that tube in place, and by having the empty barrel, it helps to aerate the space behind the eardrum that tends to get fluid and pus during an infection.
So what's typically the age that they stop getting these infections? Is there an age?
There is. So the most kids around school age, so around 5, 6, 7 years old, start to outgrow the infections. There's a part of the ear called the eustachian tube. That's the tube that lets your ears pop when you, say, change elevation, when you fly, or when you travel up a hill. And that tube is one of the underlying problems in children who get ear infections. That anatomy starts to mature and starts to work more efficiently around school age. So that's why as you get beyond that 7-year-old age mark, you start to see fewer and fewer kids who have these middle ear infections and who need ear tubes.
Now, I know parents may be hesitant of getting their children into surgery for these ear tubes. Is there any other option other than ear tubes?
Right. So there certainly is. So the other option would be to continue using antibiotics as needed with each and every infection. That being said, the benefit of the tubes is that, one, you'll need those antibiotics less frequently because you'll get infections less frequently. That two, the infections, even if kids do get them, because you could get an occasional infection even with ear tubes in, will present less severely because you won't have as much pressure buildup from the infection. And three, the children will be able to be treated with antibiotic drops rather than an oral antibiotic, an antibiotic by mouth. And the antibiotic drops work better, and they don't have a lot of side effects that the oral antibiotics tend to have.
And is there any way that children can not get infected? These infections to...
There isn't much that could be done to prevent them. With the reason being, especially in young kids, common colds are so prevalent. You know, the average child, it gets 6 to 8 common colds over the course of a year. And in young children, they don't have a well-developed immune system. Like we mentioned before, their ear anatomy is very immature, and those two factors together often predispose kids to getting these types of ear infections. Just basic hygiene is helpful in terms of hand hygiene and washing hands, but in young children, they tend to put everything in their mouth and then spread it around, and that's how the colds and then subsequent ear infections tend to become so prevalent.
Wow. And do you ever see correlation with allergy and infection, and do you ever feel like...
Sure. So, I think that the primary contributing factor are upper respiratory infections, so colds, that tend to trigger the process that leads to the ear infection. But we do see some older kids where allergy could play a role. And it plays a role in that you get, children get congested in their nose, and then in that same way that we talked about with colds, that congestion in the nose spreads to the ear and prevents that ear from equalizing pressure correctly, and that triggers the ear infection. So yes, in kids who have uncontrolled allergies and nasal congestion, it could place them at a slightly higher risk for having troubles with their ears as well.
Good. Well, that's good to hear. And I'm guessing that the ear tubes do help, and it usually treats the children most effectively?
It is. So it's highly effective in decreasing the frequency of the ear infections and of decreasing the severity of the presentation if a child were to get the occasional ear infection. With the ear tube in, the ear tube has a barrel to it. So fluid, even if it develops in the ear, will drain out. So a lot of times, many of the symptoms that kids get with an ear infection is from that pressure buildup. So you have a tiny space and you have a lot of fluid within that space, and that pressure causes the children the pain. So with the ear tube being in there, that fluid can drain from that space outward into the ear canal, and so you don't have that pressure buildup and you don't have as severe pain.
So how involved is the surgery?
So the surgery is a very straightforward one. The surgery itself is done as an outpatient, meaning that children could go home the same day right after surgery. The procedure itself takes all of about 10 minutes. Usually children are a little bit fussy that day of surgery and night of surgery, but they recover quite quickly to the point where most children can actually go to school or go to daycare the next day.
Okay. And also as a baby, I understand a child I knew had these ear tubes, but can they move at all, and then you would have to go in and fix them?
Sure. So the vast majority of the tubes fall out on their own. The tube lasts on average a year, but we see everything from them falling out in 6 months to 3+ years. If once they fall out, we see how children do, and if children are still having very frequent infections, some kids do need another set of tubes put in. When that tube falls out, the eardrum heals very quickly, to the point where you can barely tell that a child has ever had surgery on their ear. Every now and then, a tiny hole can be left behind in the eardrum, and that's what would require another surgery to patch that hole if it didn't heal on its own over time.
And everything seems effective even though that happens, and
it is. Yeah, what I'm mentioning in terms of the hole in the eardrum only occurs 2% of the time. So for every 100 cases we do, that will only occur in 2 children.
Well, excellent. Thank you so much, Dr. Nardone.
My pleasure. For more information about ear infections and about pediatric ENT, you could visit www.nemours.org.